Welcome to KSPJ News. Today we will be giving you an overview of AIDS in Africa. We will first discuss AIDS versus HIV, then a brief history of AIDS, and finally the social aspect of AIDS. First off, what do AIDS and HIV stand for? AIDS stands for Acquired Immune Deficiency Syndrome, and HIV stands for Human Immunodeficiency Virus.
AIDS and HIV are commonly confused. HIV is the virus that causes AIDS. It enters into the body through a mucous membrane, semen, vaginal fluid, or blood-to-blood contact. Once you get the virus, it slowly begins to attack the immune system by killing off white blood cells. The deterioration and destruction of immune function leads to AIDS. There are 4 stages of HIV. First, the period allowing infection is called the window. It is the time between infection and production of antibodies in a person. Seroconversion is the second stage. The body begins to develop lots of antibodies to fight off the virus. And during this period, a person may have flu-like symptoms. This is also an infectious stage. The third stage is symptom-free. This can last anywhere from 6 months to well over 10 years. The last and final stage is called AIDS. This is the period when TCELL drop to below 200 and opportunistic infections are presented.
Now, a history of AIDS in Africa. Research on the origin of the illness indicates that the spread of HIV began in sub-Saharan Africa in the late 1970s. By the early 1980s, HIV was found in a strip stretching from West Africa across the Indian Ocean. The countries north of Sahara and those in the southern cone of the continent remained apparently untouched. By the late 1980s, the epidemic began gradually to move south. And now, how does society react to AIDS? AIDS stigma exists all over the world. Those with the disease face ostracism, rejection, discrimination, and avoidance. Stigma-related violence, or the fear of violence, prevents many people from seeking HIV testing, returning for their results, or securing treatment. This turns what could be a manageable chronic illness into a death sentence and allows the spread of HIV.
Hey Sadie and Catalina, I'm Pat, here with your African AIDS forecast. I'm here to tell you about the location and current prevalence rates and concentrations of AIDS infections in Africa. African AIDS has a long history and has been most prevalent in sub-Saharan Africa, around this area. This means that up here near above the Sahara, there's little to no AIDS. Around Somalia and Cameroon, there's light levels, and as you get lower and lower into the African continent, it gets more and more prevalent. There were 22, give or take, deaths of African AIDS last year alone. This means that 1.9 million were deaths, and another 11 million children were orphaned from this disease. 2/3 of all people with AIDS or HIV live here in South Africa, while this area only contains about 10% of the world's population. Some areas actually have low concentrations, areas like Somalia and Cameroon, while other areas like South Africa and Zambia and Zimbabwe have staggering rates up to 15 to 20%. In 3 South African countries alone, the adult HIV and AIDS rate exceeds 20%, which was previously not thought possible. These countries are Botswana, here, with 23.9%, Lesotho, 23.2% here, and Swaziland, the highest rate in the African continent, has 26.1% prevalence rate. However, as you move west, you'll see that West Africa has been far less affected by African AIDS and HIV. Now, the good news is that it appears that African AIDS and prevalence rates seem to peak in their 90s, and although it may be going pretty slowly, prevalence rates are going down all across southern Africa. Overall, Africa's AIDS rates, while high, are declining. It just needs more research, time, and devotion from companies and other organizations that are going in free and giving help to those people. The true effect of prevention campaigns can be shown by the countries such as Senegal and Burkina Faso, whose HIV rates have declined by over 2% in the last 10 years. This is a great achievement, and in more distant countries where it is harder to get AIDS is much higher, just like Lesotho or South Africa, where rates are but where AIDS rates are above 20%. AIDS is taking a toll on the health care of female workers with HIV and AIDS in all infected countries. Countries like Botswana have 17% rates just in women, and 40% of the housewives have been at least directly affected by AIDS, either by a family member or themselves being infected. About 75% were projected to get AIDS, which is why scientists were surprised that only about 40% were infected. A study in Zambia found that AIDS is taking a toll on the southern part of Africa as well, which means that even though AIDS rates are declining, it looks as though it's kind of dispersing, spreading out. It's spreading slowly upward, and West Africa, which was once not infected, is slowly, their rates are climbing, while Eastern and Southern Africa, rates are declining. This also means that other countries who have never had to use AIDS aid before, aid to that infection, they don't have that aid, which means that more people are dying. There you have it. That's about what's going on in AIDS in Africa, Southern Africa. No AIDS up here, remember that. Back to you, Sadie.
Thank you, Patrick. Hi, I'm Jasmine Moore, and I'm here in Port Elizabeth, South Africa, where several outbreaks of AIDS have occurred. I was able to sit down with a woman named Nasi, who is currently living with HIV, and she told me her story. She'd been living with her boyfriend Quincy for a few months, and had a stable relationship. But that all changed when Quincy came back from a doctor's appointment one day and told her that he was HIV positive. He suggested that she should be checked as well, but she put it off until she got pregnant, and then she had no choice. She took the test, and the doctor told her that she was HIV positive. And in February of 2002, she gave birth to a girl named Chica. During the interview, she told me, "She was the only thing keeping me alive. I lived because I was carrying her, and every day I talked to her, apologizing for bringing her into a world with such a risk." Nasi waited until Chica was old enough to be checked, and fortunately, the test came back negative. Nasi now lives with her new boyfriend named Paul, who she immediately told about being HIV positive, and he accepted her. Chica is now 4, and they now live happily together in Port Elizabeth. Here's another story that doesn't have such a happy ending. A neighbor of Nasi's told me of her husband, who had been working at a small clinic in southern Cameroon. When he suddenly fell sick, no one knew what was happening to him. It was around the time that AIDS was still a mystery in parts of Africa. His family thought it was just a bad case of flu, and were shocked when he died shortly after. The widow told me, "No one has been able to tell our children, and fear that it will leave a negative impact on them." He left behind his wife and 4 children. In more depressing news, over in Zambia, where the AIDS infection rate is also high, Zambian police say that 400 cases of child rape were reported in the first half of 2003, a 68% increase in the previous year. Many men believe that having sex with a virgin can cure AIDS, but it's just the opposite. Victims of the rape, mainly young girls and women, end up acquiring the disease and also get pregnant, in which case the child could also be infected by the virus. Now some 20% of Zambians are all HIV positive, and the case is the same here in South Africa. Because of the illogical rapes, 800 people die a day from AIDS-related diseases, and is now one of the most severe AIDS/HIV epidemics in the world. Girls as young as 3 years old have been victims to this widespread tragedy. Because of the guilt and the memory of the event, rape victims rarely tell anyone about it, which increases the probability of spreading the disease unknowingly. The former president Mbeki has been directly blamed for the 330,000 AIDS deaths in the country. There have been several protests, many led by South African rape victims, to bring him down. They succeeded, and now have a health minister that is aware of the disease and is doing all that he can to help. Though he has helped solve some of the spread of AIDS, there are still young women and children that are either raped or have acquired the virus from their mothers and are still suffering. It will take a while for AIDS death rates to settle down. But until then, I'm Jasmine Moore in Port Elizabeth, South Africa, from KSJB News. Back to you.